I am Dr. Abhay Mahajan, practicing at Sai Urology Hospital in the city of Aurangabad, Maharashtra, India. Today I am going to give you information about prostate gland and its problems. Prostate gland enlargement usually occurs in elderly men. This is a small gland which is situated between the bladder and the penis. Through this gland, urethra, a small tube which passes through the center of this gland, which takes urine from the bladder outside the body. When the prostate gland enlarges, it presses into the urethra and gives symptoms to the patient. The patient usually has frequency of urine, that is, he has to pass urine more number of times, has to get up in the night more frequently to pass urine. The patient also loses control over urination, like till he goes to the bathroom, the urine leaks. At later stages, the patient has a poor stream or thin stream. Patient has to strain for passing urine. The flow is not continuous, it is interrupted, and some amount of urine remains inside, and patient has that feeling of sensation of incomplete voiding. If the patient doesn't take treatment in the initial stages, then these problems they worsen and the patient develop complications of prostate gland. The complications of prostate gland are repeated urinary tract infection. The patient has blood in urine. He develops bladder stones. The residual urine or the urine which remains in the bladder, it increases, and this leads to pressures in the kidney, and in the last stage there can be kidney failure. The patient requires certain investigations or tests to diagnose the prostate gland. The most important investigation is to do an ultrasonography, which gives a good information about the size of the gland, about how much urine is remaining in the bladder, and whether the kidneys are normal or whether there is hydronephrosis or swelling in the kidney. The next investigation which is done is to do a uroflowmetry, that is to test the flow of urine. This tells us whether the patient has a good flow rate of urine or the patient has a poor flow of urine. The third important test is to do a blood test which is known as prostate specific antigen, which tells us whether this prostate gland is normal or whether there is cancer. All the prostate glands which are enlarged are usually benign, that is, they do not have any cancer in it. Only about 20 to 25% of the prostate glands they have cancer in it, and this is diagnosed by this blood is known as PSA. Hence, to do this test is very important to diagnose prostate cancer in these patients. The treatment of prostate gland depends on the symptoms of the patients. The patient's symptoms does not correlate with the size of the gland. Even if the gland is small, the patient can have severe symptoms, and even if the gland is very large, the patient can be completely asymptomatic or the symptoms are very less. So the treatment is only if the patient has severe symptoms. Usually the treatment options are to give medicines or to subject the patient for surgery. There are excellent drugs or medicines which are available which gives good relief to these patients. The patient, once they are started on medicines, they have good flow of urine. The frequency and the nocturia or in nighttime frequency significantly reduces, and the patient has good relief of symptoms with good urine flow rate. The surgical option or the surgical management is preferred only if these patients don't have relief with symptoms with medical management, or the patient develop complications like retention of urine, that is, the urine gets completely blocked, or the patient has repeated infection, blood in urine, he develops bladder stones or kidney failure. In these patients, surgery is must, and the patient has to undergo surgical treatment. The surgical options for prostate gland are usually endoscopically, that is, the patient doesn't have any scar or sutures on the body. The commonest surgery which is performed is known as transurethral resection of prostate or TURP, where a small endoscope goes through the urethra and the complete gland is removed endoscopically. The second surgery, which is the latest available technology, is known as laser prostatectomy. Various kinds of laser are used to remove the prostate. These are holmium laser, thulium laser or thulium fiber laser. The advantage of laser prostatectomy is any type of gland, large gland, can be subjected for laser prostatectomy, The chances of bleeding are very less this type of surgery, and patients who have cardiac problems or patients who are high risk can be subjected for laser prostatectomy. Usually after surgical treatment, the patient has excellent relief, the flow rate improves significantly, the patient is symptom free for a long period of time.